What are the risk factors for anesthesia awareness? Imagine lying on an operating table, completely unconscious, yet your mind remains awake and aware. It's a strange and unsettling experience that can happen during surgery. But what makes some people more likely to face this bizarre situation? Let's explore the main risk factors behind anesthesia awareness. First, technical issues with how anesthesia is given are a big factor. Errors in dosing, malfunctioning infusion pumps, or giving muscle relaxants before enough sedation can cause awareness. Muscle relaxants paralyze the body, making it impossible to move or speak, which makes awareness harder to detect. If the anesthetic isn't properly administered, the brain might stay partially awake during surgery. Second, individual differences among patients also matter. Some people need higher doses of anesthetic drugs because of genetic resistance or because they regularly use substances like alcohol, opioids, or benzodiazepines. These substances can increase the amount of anesthesia needed to keep them unconscious. On the other hand, if someone is acutely intoxicated, they might need less anesthesia, which can be tricky to manage. Third, health conditions and age influence risk. Older adults often requiring lower doses of anesthesia to prevent complications, but this can increase the chance of awareness. Women and patients with heart problems like congestive heart failure also tend to receive lighter anesthesia to keep their blood pressure stable. Obesity can make airway management more difficult, leading to longer induction times and potential gaps in anesthesia coverage. Fourth, the type of surgery plays a role. High-risk procedures such as heart surgeries, emergency trauma operations, or cesarean sections tend to have higher rates of awareness. These surgeries often requiring rapid induction or lighter anesthesia to respond quickly to emergencies, which can increase the chance of the brain waking up. Fifth, certain medications and substances can interfere with how anesthesia works. Drugs like amnestic agents can mask signs of awareness, while stimulants like amphetamines or medications like beta blockers and calcium channel blockers can blunt the body's normal responses. This makes it harder for anesthesiologists to tell if the patient is adequately anesthetized. High doses of vitamin C have also been linked to interference with anesthetic effectiveness. From the perspective of strange science, anesthesia awareness is a bizarre phenomenon. It's like the brain flickers back to life while the body remains paralyzed. This strange state challenges what we know about consciousness and how the brain responds to drugs. It shows us that even when we think someone is fully asleep, parts of the mind might still be awake and aware. To reduce these risks, anesthesiologists carefully monitor the depth of anesthesia, avoid giving muscle relaxants too early, and adjust doses based on each patient's health and medications. After surgery, patients are often interviewed to see if they experienced awareness, and psychological support can help if they do. Understanding these risk factors helps make surgeries safer and less frightening for everyone.